Okay, this video is called Are Patients Irrelevant? And it's a little bit of a joke, but there's truth in it. So basically, most medical problems are relatively standard. Of course, there's lots of exceptions, but most of them are pretty standard. Most have a relatively standard lab test, let's say for obesity, what's your BMI, hypertension, your pressure, diabetes, your hemoglobin A1C, your sugar, erectile dysfunction, coronary artery disease, your total cholesterol, etc. Healthcare providers follows a standard set of questions and related blood tests. And so that's sometimes been called checkbox medicine. And there's more and more of this trend towards checkbox medicine. Okay, there's sometimes, standard imaging tests, ultrasound, confirm a fatty liver. It's more echogenic than the kidney, for example. Standard treatments, take this pill. And so this idea of match the ill to the pill and send a bill has also been called checkbook medicine. And it's based on science funded by the drug industry, and that's been called checkbook science. So the point is it's revolving around money rather than real science, okay? And then why the joke? Why are patients irrelevant? Because as long as the standard of care is followed, then it really doesn't matter what happens to the patient. And that's why it's kind of a joke that the patients almost become irrelevant. That's amazingly true. You'd be amazed how much that is the case. So what's coming next? Artificial intelligence is the big thing on the horizon. And ideally, they're going to want patients to type their symptoms into a keyboard kiosk. But of course, that's not going to work because anybody who really takes care of a patient knows, most of them are too mentally slow and illiterate. They're not going to be able to do that. But still, they'll have somebody to help them do that when they can't do it themselves. And then they're going to get prescribed drugs based on science funded by the drug companies. So what progress, okay? And, we talked about this before. Drugs never cure chronic disease. They never do. Not even 1%. They never cure diabetes, hypertension, erectile dysfunction, coronary artery disease, autoimmune disease. Okay, surgeries occasionally will cure like an obesity, but often that's only temporary. Okay, we know they don't cure coronary artery disease very well. All right, and so what I'm saying is if people in the public realize this, they wouldn't be so eager to rush and get all these pills and surgeries. Also, patients love going for x-rays, ultrasounds, CAT scans, MRIs. It never occurs to them these are just diagnostic tests. They don't cure anybody, okay? You don't cure yourself with a CAT scan. Sometimes they've been helpful to get the correct diagnosis, but quite often they're done almost like I said, people going on a pilgrimage, to Canterbury. They don't, but actually that's probably more helpful to cure. You can cure a patient on a pilgrimage. But anyways, a lot of patients actually were cured on pilgrimages, so be that as it may. Big improvement comes from optimizing nutrition, avoiding toxins, having a sense of purpose in your life, sleep, fun, family, friendship, religion, exercise, avoiding EMF. Okay, that's all well and good. We talked about that in other lectures. Nutrition-based medicine also leads to conversations and questions, okay? You can't just checkbox it. Patients always have lots of questions. What about this, and this? And nutrition-based medicine routinely cures chronic diseases. And I have said that before, that if conventional medicine really wanted to improve, it would have to track outcomes. But no one ever does that. And also, no one that really runs medicine, the high ups, they don't want medicine ever to become accountable. Because if it did, and you competed on outcomes, anybody could easily just use a plant-based approach, and they would get 100 times much better results than anybody working with drugs. So it can never come down to that. They'll never let it come down to that. But to the educated patient, standard of care is kind of a joke. Standard of care is all based on patients who can't cooperate with their care. It has to be, because lots of patients can't cooperate with their care. It's a very high percentage cannot. So it has to always be based on lowest common denominator. But for any person who's educated and willing to read and make some effort and they're curious, they can routinely, easily outperform standard of care outcomes. So I just thought this was a little interesting, this idea of the patient sort of is irrelevant in the whole thing. It runs between the healthcare provider, the insurance company, and the drug company. The patient's just there to be a cog in the machine, if you will. And this artificial intelligence that's getting so hyped, what is it going to do? It's just going to be based on whatever the drug company says they want done. So, anyways.